hospital-based medicine side a couple of weeks a month. So I'll be seeing all of you on the wards, getting to know you and your stories. And one of my roles here in the program has to do with the Mentorship Program. So the purpose of the Mentorship Program and how we try to do it is to help you guys succeed and meet your goals as we go through the process of learning and growing. So starting now, you try to learn how, where are the food, water, and shelter? How do you get your basic needs met? Okay? Mostly you don't need your mentors to get you to that point. Okay? You guys are all adults. You've got a house to live in. You've got food, water, and shelter. The next steps will be, well, how do I get through the day, work-a-day life? It starts on July 1, and you guys will do well. You'll do well. It's going to be fine. This is not the first July 1, but it's your first one, and we're going to try to help you through it. One of the ways we do it is through the Mentorship Program, and so we pair you guys based on some data, usually in your application, that connects you to one of the faculty members that has a role for mentorship. So we kind of pre-assign it for you. We found that if we wait till you do this or figure this out, then most of the first year gets gone before it happens. And so the mentor role has a formal part and an informal part. The formal part is that they meet with you and you fill a self-assessment form and check the check boxes on your to-do list items that are non-clinical duties detailed for your reading pleasure in the program guidelines. If there's anything that you can receive still in terms of new knowledge in the orientation process, it is, if you have a question about the program, look at the program guidelines. 99% of them are answered that way, including what's in the mentorship program and who's my mentor, okay? Formal part, twice annual meetings with some documentation that we use to inform your presentation to the Clinical Competency Committee, which Dr. Shah will be telling you about a little bit later. And then the other formal role for your mentor is if needed, they will act as your advocate as well for the Clinical Competency Committee review. Informal parts of the mentorship program is where the fun part comes. So if you have a way to make a connection to someone who's doing scholarly activity in the field of your interest, or can help you with troubleshooting things like taking tests or building your resume so you can get into a fellowship and write you a fantastic letter of recommendation. These are all things that are a part of the informal parts. Sometimes people will go over to dinner. They used to before coronavirus, and have dinner at their mentors' houses and such like that. So, like I said, the mentorship program kind of fits into those two blocks, okay? And the first introductory thing that we do in the mentorship program is when you're here in your orientation, I give you a little sheet, and you take 5 minutes and you fill out this sheet, and then I introduce you to your mentor, and it has a little bit of information about you and about what you're thinking coming into residency, and then that's the connection point. And the next connection point that I make for you will be around the fall when you're getting ready to have your first review, where you've already kind of come through the survival skills in residency, and now you're starting to think about what happens next. All right. So that is the intro to the mentorship program. And I've got your little sheet that you write on here. You guys remember how to write with a pen and pencil? Okay. Alrighty. Anyone brought a pen? I found 5 on my desk, but I did not find enough for everyone. Thank you. Yes. Is this the same as our specialty mentor? No. There is all kinds of ways to do secondary mentorships if that's what you would like to do. So mentorship by committee tends to actually work better. So if you hit it off with someone and you're like, I want this person to be with me, mentoring me through the process, then we can always change and adjust those things. What we found was that with the people coming in their first 6 months, if we did not assign you a person, then it never happened. So take the next 6 minutes and fill out this basic information, and then I will take them up and make your connection to your program mentor.